All right, we'll call this meeting to order. All right. I have a motion to approve the work session agenda as amended with changes on page 3. Okay. All in favor, say aye. Aye, pass 4-0. All right. All right, no discussion items. All right, I guess, Elise, are you going to give us the Human Services update? Thank you.
Commissioner Jones, before we get started, can I just confirm that Lynn Shue is not on video and he is not here tonight?
I don't think he's on. I don't know if he's on. Yeah, he's not present.
Okay, thank you.
Okay.
Is it on?
Yeah.
Yes.
Good evening, everyone. Thank you so much for this opportunity. So in Health and Human Services, we just wanted to provide some updates to the board regarding 3 distinct occurrences that are happening at sort of concurrently, but wanted to provide you some information. So we'll talk about each one separately and give you a brief update in regard to the federal shutdown and what impact it's having on human services programs here in Cabarrus County. Then we'll also talk about North Carolina-driven Medicaid cuts and what those cuts that went into effect on October the 1st and will be enforced beginning on November the 1st, what impact that would have to our local economy and community as well. And then the last thing that we will touch on is H.R. 1, otherwise known as the Big Beautiful Bill. And so to aid in this conversation, I'm going to invite program administrators Heather Altman and Robert Cox to join me at the table. And I will also ask Sue Yates from Cabarrus Health Alliance to join us as well. If there's any specific questions regarding how these programs or how these changes are going to affect our public health department, Sue has graciously agreed to answer those and field those questions. So I'll turn it over now to the presentation for us to get started. First, again, we will talk about the federal shutdown. There's been a lot of attention to that lately. And Robert will provide us most of those updates. So as soon as we get to, we can go all the way to slide 3, Ari, and I'll invite Robert to start us off.
Next slide, please. All the way to the 3rd slide.
There you go.
I'd say good morning. It's been a long Monday. Good evening. The first thing I'm talking about tonight is the federal shutdown impact. One of the most immediate impacts, I'm sure you've heard unless you live under a rock, is that the SNAP benefits may not go through this month. So we wanted to give you some context as what that means for Cabarrus County. They call programs, I'd say it's a program of 1,000 names because it's SNAP, it's EBT, it's food stamps, it's food and nutrition services, all the same thing. But in Cabarrus County, we have a little over 24,000 citizens that are receiving food and nutrition services benefits. On a monthly basis, we issue 4.1 million in benefits a month. That is majority spent in the community at local, grocery stores, convenience stores, farmers markets, those kind of things. And interesting, our caseload is 47% are 17 and under, so almost half of our caseload include children. So out of that 24,000, about half of those are children. The other half is made up primarily of like parents and senior citizens. Next slide. I think I might go backwards on this one because of things that have happened just on the drive here. When we heard about the shutdown, we started as a county to put information on our websites and put it out on social media. We went in and did robocalls to all our recipients, kind of warning them this may happen, and be on the lookout for it. So we've tried to get that information out there every way we can. Even in the shutdown, the instruction we've received from the state is that we're expected to continue business as usual. We're expected to continue to take applications, complete recertification, complete changes, meet all of our timeliness and accuracy standards. So it's business as usual for us. It's just that benefits are not being issued at this point. participants that already have benefits will be able to use those through their EBT card until they're exhausted. And the reason I left that first one for the last is because originally, November 1st, when we did this last week, there were no benefits going to be issued. There were no benefits issued today. Today is our first issuance cycle for our county, and it goes every other day through the 20th. So there were no benefits issued this month. There is news that because of the two judges, that there will be half of a monthly allotment issued. So we're waiting on guidance from that because we have to take all of our guidance from the state. So at this point, we're waiting to hear what that impact may be. So.
And just to add to that, just briefly, so if the partial benefits do come through, again, as Robert mentioned, beneficiaries will likely not receive them until mid-month or late month. And then the other part of it, my understanding is that reserve fund would be depleted if those partial benefits are issued during the month of November. So should the shutdown continue into December, we would be in a position where beneficiaries wouldn't be receiving any benefits at that time. I'm also going to invite Sue to talk about how, yes, you just push it. Hopefully it'll light up for you. There we go. Because the shutdown also has implications for WIC services, so I'll turn it over to Sue for that.
So I'm Sue Yates with Cabarrus Health Alliance. I'm the finance director. We did receive notice today that WIC is funded through November the 30th with assistance from the state if needed. We currently have 4,073 participants on WIC. We are most concerned about the 972 infants that receive WIC benefits because we all know formula can be expensive. But we are glad to know that it is funded through November the 30th. We have children. There's 2,215 children and 886 women that are either pregnant or postmortem.
Great, thank you. So we're going to turn our attention now to the second occurrence, which is the Medicaid cuts. But before we do that, are there any questions about the federal shutdown? I know it's a little complicated, so wanted to keep them sort of distinct. If you had any questions about this part before we shift gears to the Medicaid cuts.
I don't have any questions necessarily about it, but we have posted, and I think I've seen on our site too, any food pantries or anything like that that is offering resources to our
We have, absolutely.
residents.
And we're
We
keeping
have
that
also-
updated. Go ahead.
We've also put those on social media, and at our DSS, we have it on the phone bank. When someone calls in, they hear it too. So, and it gives them the links for 211 and those kind of services. So.
And I will also mention that the North Carolina Department of Health and Human Services also has resources listed on their website too.
I got a question. You said something about this month you may get half issued?
Mm-hmm.
All right, so I'm assuming that everybody gets 50% of what they normally get across the board.
That would be our assumption, yes.
And that half is coming from
The federal government.
federal government? Is that based on that lawsuit, or is it based on
Well,
something else?
all FNS benefits are federal dollars. So when we talk about our issuance, like the 4.1 million a month, those are 100% federal dollars. So at this point, any of the benefits issued are federal.
I understand, but do
Yeah.
you know if that money that's going to be issued for the half, is that something that was already allocated, or is it something that they're doing in response to the
It
judges?
has to do with
court?
the.
It's in response.
Yes, the response with the, the reserve funds at the federal level. They're using part of the reserve funds.
Part of their reserve funds they're bringing out
Yeah,
just for that.
yeah.
It's emergency funding that they've allocated.
Okay.
As far as the,
And
go ahead.
I'm sorry. Then as of today, with that ruling, weren't they supposed to begin funding tomorrow? Or
The order says they have to have a plan by Wednesday, but again, and we always have to wait on automation from the state Generally, anytime you shut down a computer program, I worked for the state for a long time and worked with this computer program. It's easy to shut it down, but it takes days to get it back up and running. So we, again, have to wait for guidance from the state as to when those may be available. That's, I think, Elise said. Our guess from previous times, any kind of disruptions happen, it's going to be a couple weeks, but we don't know for sure.
And in that couple of weeks would be, they get retro pay for their back. If we go, if they clear everything, I mean, elections tomorrow.
Yeah.
I imagine
Historically,
federal
yes.
is gonna do something after that and
Well-
resolve this budget problem, hopefully.
Yeah, I say historically, but the food stamp program started in 1964, and this has never happened before. But, you know, our hope is that, yes, they would be able to do retro pay for everyone.
But this is like a brand-new development, so again, as Robert mentioned, we are waiting for additional guidance.
Right, I understand. I'm just trying to understand it. And I've been through a couple of the community meetings about it and stuff. Like, impact. When will we actually realize the impact? When will,
It'd be pretty immediate, actually, because we're talking about $4 million that's not going to be issued and spent within the county, just in November alone. At the best we can hope for is that instead of that $4 million, we'll get $2 million that's spent, you know, Food Line and Harris Teeter and all the other things. So it'll be a pretty immediate hit.
have we looked at our current food banks, food supplies, and see what we have to provide people during that?
The state.
I'm hoping it's a 2-week window.
Yeah, the
from
state
today.
works very closely with all of the food banks within the state, and we, again, have referral sources on our website. We refer, there is a number, it's like, instead of 411, it's 211, that you can call and find out about any kind of community services, so we give out those referrals for that. Yeah.
And we did hold a community discussion last week with all of our community stakeholders. And so that was an opportunity for people to kind of share what they felt like the impacts were going to be. But again, this is, as Robert alluded to, this is all sort of a new development, especially for SNAP. And so we're kind of in a wait and see mode.
Right. But from that meeting, yeah, we were developing action points. Since that meeting on that action point, and you're doing a wonderful job. I was impressed with that meeting and stuff. But what steps have we taken since that meeting to get where we are ready to implement those action points?
So the best that we can do at this time is to make sure that the resources that are available in our community are available on our website. And we continuously do that. This team works very closely with communications. If they learn of any new resources, they're feeding that information to our communications department, and we're updating our website in real time.
Then
And
one
we're
other
also getting the
question.
message out to the community.
Again, I don't know a lot about it. One other question. Does the SNAP program and this situation affect anything about the lunches at schools or?
We have not gotten any information on that. USDA has its fingers in a lot of pies, and yes, USDA does fund school lunches, but we have not received any information on whether it's going to affect them yet or not.
So right now, we're saying no because nobody's brought it up.
Yeah.
Okay.
We continue, even with the shutdown, we continue to encourage people to apply for benefits and can do their recertifications, because one of the things with free lunch is that if they are receiving benefits through FNS, they're automatically eligible for those free lunches. So we constantly encourage that.
One other thing. All right. How do we, and this may not be how we can even quantify this, but how do we know that what we do set up for resources and things are actually going to the ones who lost the benefits? There's no way to determine that, correct?
Not unless we ask the question. And, that would be up to individual nonprofits and food banks as to whether or not they wanted to ask that question. But we're not collecting that information right now in any kind of
And
structured way.
anything the county can do to help in this situation is we have to lean on the backs of these community groups in some way to to help them get to the people.
That's probably our best course of action at
okay.
this time with the resources that we have available to us.
Perfect.
As far as
Thank
WIC,
y'all.
as far as WIC goes, for the SNAP, people have food pantries that they can rely on. Where do the women with children go who have to have formula? Is there a backup for that, or are they just out of luck?
A lot of the food banks do have formula donated to them, so they can go there and see if there's any formula available and rely on community partners. We're working to see if this program does become unfunded, what we can do to help support to ensure those infants are getting the food they need.
So I do know the Concord Women's Center, Cabarrus Women's Center, Jane Daniel, who heads that up. I know that they have resources out there too, and I'm sure that they will be, especially for mothers and babies. That's their mission, is to save lives and save those babies. So I'm sure that they would be a great resource, to reach out to for infant formula.
And I'm sure they would, but you said 972 infants are currently on WIC. And I know with my granddaughter, we were going through about eight cans a month. So 8 times 972, that's a lot of cans of formula that they're going to have and have resources to get. So that's a big impact.
One thing that occurs to me, it's great that you put all this stuff, information on the website, but there must be some percentage of people who are in real need, who have no access to a computer and can't get on the website. What can be done to help them?
Yeah, that's an excellent point, Commissioner, and I absolutely agree with you. And I do think this is really a community effort, right, in terms of us just checking on our neighbors. And if we know of families in need, reaching out to them and making sure that they have adequate resources. But I could not agree with you more.
I'm just afraid some's gonna fall through the cracks because they didn't know.
Absolutely.
And we feel like that's the purpose of the robocalls that IT has been helping send out for the FNS recipients. We are giving them that information over the phone. North Carolina DHHS has been sending it out via text message. So it's going out on several platforms that hopefully, if they are receiving, they have some type of form to receive that information, whether it's text, a phone call, online, social media.
Well, I will say, I know from personal experience how important WIC is.
Right.
Because when our daughter was a baby, and I was a student supply pastor at a church in Greenville, North Carolina, I got $100 a week and $200 a month for my rent. Rent was $175, so that was an extra $25 a month out of the rent money. And until I found a second job to do at the same time, we'd have been in a mess without WIC, so I understand the need.
Let me ask another question, just follow up. Since November 1st, this went into effect and we sent out robo, has there been a volume of calls? Has there been a volume of people increased reaching out? Has the need shown up yet?
Our calls have not, they have increased, but it hasn't been a dramatic increase because we think that the robocalls helped with that. Plus, it's on the news, 3 times a day, every day, and those kind of things. So, yes, we have had some increased calls, but it hasn't been anything that's overwhelming.
All right, I can move on to the next.
Yes.
Yeah, no, thank you. So again, just want to briefly talk about this next occurrence that is happening in real time. And this is an adjustment in the North Carolina Medicaid rebase. And I understand this information is a little confusing. So just trying to simplify it. As we all know, Medicaid is a program to provide health insurance benefits to individuals who qualify. In North Carolina, the rebase is used to recalculate on an annual basis how much Medicaid pays providers based on sort of the recent data, right? So where are the utilization patterns? How many more people were enrolled into Medicaid? What are some of the policy changes at the federal level? So based on that, a new calculation comes out annually in terms of how much is needed in the Medicaid program to continue paying services at that current rate, right? And so The example at the bottom, so if hospitals' operating costs have increased since the last rebase last year, then the new rebase may raise the Medicaid reimbursement rates to reflect that. So that's sort of how it's a recalculation that's done on an annual basis to determine how much is needed to continue to fund the program at its current rate. Next slide, please. So what has happened this year is the decision was made to cut the rates. And that was based on the rebase calculation that happened earlier this year. And so the question for many people is why? Why are rates getting cut? And if you go to the bottom in the bold, what the North Carolina Department of Health and Human Services has told us is that the state budget did not appropriate sufficient funds to meet the projected costs or the rebase of the Medicaid program. And the cuts are within the law, since the agency must operate within the funding provided by the North Carolina General Assembly. The cuts are reversible if additional funding is provided, but in order to keep the program solvent, the rate cuts were necessary this year. And so across the board, there was a 3% rate cut for virtually most Medicaid providers and services. There were larger cuts around some of the more expensive services. So for instance, some specialty physician services received an 8% rate cut. And then for those really top-tier, high-cost services, there was a 10% reduction. And those included hospitals, like inpatient care and services, nursing homes, as well as behavioral health services, including psychiatric residential treatment facilities. Those of us in the child welfare space are often looking for PRTF services for our youth in custody, because that's a service that's oftentimes recommended for them. So the rates were cut on those services as well. So, and I'll again invite Sue to chime in, because she knows this well, because obviously she's the finance director for Cabarrus Health Alliance, and so they're actually seeing these rate cuts on their end. But this is what providers are telling us the impact will be. They say these cuts could threaten access to care, especially in rural areas or for providers operating on thin margins. Last week, I attended a state health reform in which there were several legislators present, and they certainly seemed well-versed in the implications associated with the Medicaid cuts and understood that a lot of these providers, especially in the behavioral health space, operate within a 60-day margin, right? So if they don't have more than 60 days of savings, so the rate cuts are really hitting them hard. Most health plans, what they did, even though the rate cuts went into effect on October the 1st, they delayed it for a month. So they delayed it until November the 1st. But now that we're past November the 1st, not only will the health plans be implementing the rate cuts, but they will be retroactive back to October the 1st. So again, there is concern that some of the services might be eliminated over time if the rate cuts stay as they are, and that access to care could be compromised for some individuals. So I'll pause there, and I will ask Sue if you have anything that you wanted to add.
So we are seeing an 8% reduction in our primary care and our behavioral health services reimbursement, and 3% in our dental services reimbursement.
Any questions that I can answer about the Medicaid cuts? And want to make sure that people do understand this is a North Carolina specific phenomenon. This is not something that's happening across the nation per se. This is related to North Carolina. Yes, sir.
So this is based on the state budget is why
Correct.
we're doing this?
Correct.
All right. These, I'm making an assumption here, with these physicians and other things not being able to absorb that cut themselves, would that not push more people to the hospitals and cause even a bigger issue there?
Yeah, so that is a prediction that we would see, for instance, more people showing up in emergency room departments, because statutorily, emergency room departments, as you all know, are required to resolve an acute issue, right? But even if a person can't pay, they still can go to the emergency room department, they can still get stabilized. But if they can't pay, then they just can't pay. And so those costs are oftentimes having to be absorbed by the hospital system, and eventually they trickle down to the consumer as well. That impacts all of us, though, if our emergency room departments become clogged with people who can't otherwise access services. Yeah, they are clogged, absolutely, yes.
Right.
So this could potentially worsen that.
All right, then with nursing homes, so what happens in that aspect? Because some of these nursing homes not gonna be able to keep the people they have at the rate, at this rate, and make money. So what's,
So
what
the-
are they saying they're gonna do? I mean, it costs so much.
Correct, yes, it is a very high-cost service. So if they're unable to keep their doors open, we could potentially see closing of some nursing homes. On the behavioral health side, which, as you all know, is a more my specialty, part of the concern for, again, those psychiatric residential treatment facilities is that even those that operate within North Carolina won't accept our kids. Because if another state is paying a higher rate, even under Medicaid, they'd much rather take a child with this very similar profile, but they're gonna get paid more for a non-North Carolina kid versus a North Carolina kid. So those are the kinds of things, conversations people are having in this space.
All right, we cannot, as a county, subsidize what the state and Medicaid doesn't do. So what can the county do in this situation? What are our options?
I don't think there's really a call to action for the county per se. This is more in terms of awareness.
Okay.
So just for my clarification, because this is very confusing.
Yes, I understand.
There was obviously a reason that they made these cuts. So what were the reasons that the legislators gave to make these cuts to
Yep.
Medicaid?
If you could go back for just a second, Ari, to the slide before. I think I kind of glossed over this point. So in years, I don't even know if I actually have it up here. I don't actually have it up here. In years past, so the rebase happens every year, the recalculation. In more recent years, the state had some additional funding. So for instance, they used COVID dollars to make up the difference. That funding has now been exhausted.
Right.
So now we're in a position of, hey, how are we going to continue to fund this?
So in reality, So in reality, to your point, all of that emergency funding that came in through COVID is what is causing us to have to make these Medicaid cuts now? Because in reality, we flooded the system with a bunch of extra money that people used and gave a lot.
So how I would conceptualize it is this recalculation was going on even before COVID, right? What's increasing is healthcare costs in general, right? But over the course of the COVID period, the state was able to use some of those additional funds to help make up the difference, and those funds have just been exhausted now. So I don't blame that extra funding that was available during the COVID era. Really, it's just healthcare costs are rising across the board for every level of service. And again, Sue, if there's anything else you want to add, being in the healthcare space yourself.
Yes, every year the services, health insurance goes up, retirement costs goes up, cost of living increases, and it just causes populations keep increasing, and that increases the cost of care. Also, there's more, whenever you call to make an appointment, you usually have to wait 3 months or more to get in. Most people can't get in unless it's a sick appointment the next day. So the number of providers are not as high per population either. So you have to pay more to keep the providers or to keep the nurses in your system versus them going to another system.
Any other questions related to the Medicaid costs?
When will we start seeing the impact here of this?
We anticipate, so, as Sue mentioned, they're already feeling it with Cabarrus Health Alliance because they're in the space and they are a Medicaid provider of service. So the impacts related to these, we should probably start seeing some of those effects pretty quickly, especially for those smaller mom and pop providers, maybe in the behavioral health space that just can't afford to keep their doors open if a decision isn't made to fill in the gap, because that is a possibility as well, that our General Assembly could vote to fill in the gap.
But they could choose to not accept Medicaid patients and do it on private business.
They can definitely limit the number of visits available to folks, and then that would cause, so in the past, we've seen a big influx of Medicaid patients because some providers are already full. And then, so they come to Cabarrus Health Alliance. So a large number of our patients are Medicaid. We expect over a $200,000 decrease because of these cuts to our provider reimbursements for this year.
So to basically turn your hospital into a primary care facility?
The emergency room.
Yeah. Okay. Thank you.
Yeah, thank you. All right, we're going to shift now gears to the last occurrence, which is HR 1, otherwise known as the Big Beautiful Bill. So this doesn't have any impacts at the moment, but we do foresee impacts beginning in 2026. And so again, the reason why we wanted to bring it to your attention, especially as we're going into budget planning season. So I'm going to turn it back over to Robert.
Okay. Next slide, please. We tried to break these down and keep them as simple as possible because, as you said, it can get very confusing when you're talking about all these numbers. But some of the changes, we're just talking about our Medicaid and our FNS. Some of them apply to both of them. Some will apply just to one or the other. The key changes that we expect to see immediately is the increase in county costs for FNS. So part of the bill, HR 1, was that it traditionally, well, has always been, that the feds pay 50% of the administrative fee and the county pays the other 50%. 25% of that is being shifted to the county, so the county will now be responsible for 75% of administrative fees, and the feds will only cover 25%. The prediction that we have is that would add another 1.2 million to the county annually. Both programs are looking at stricter work requirements. FNS already has work requirements. They're actually just changing those a little bit. Medicaid traditionally has not had work requirements, and those will be part of the Medicaid program. Again, none of this has gone into effect yet, so it's coming. The other is higher staff workload because Medicaid, right now, the majority of their cases are certified or recertified once a year, but with the new bill, they're required to do twice a year. So they're required to do it every 6 months. So immediately, it will double the number of research they have to process. And then there's also the risk to Medicaid expansion because there is a trigger law in North Carolina that if the expansion or federal funding drops below 90%, it immediately terminates the program. So that's out there on the horizon too, or possibly. Next slide. Again, to give you some concept of how it applies to Cabarrus County directly, we have the 24,147 FNS recipients. We currently have 55,527 Medicaid recipients. Next one. And how we have been, or not instructed, but what we've been told, the percentage loss for FNS would be around 15% of our caseload when these new rules go into effect, which would translate to 3,531 people losing their FNS benefits. If Medicaid expansion goes away, that would terminate 12,000 people from their medical coverage. Again, major things driving these are the work requirements. For FNS, it's gone from 18 to 54 to 18 to 64, so they added 10 years that people must have the work requirements. They also got rid of some exceptions, which they got rid of exceptions for veterans, for foster children, from the ABOD provisions, which limits them to 3 months of benefits out of a 3-year period. And then also for Medicaid and FNS together, they have stricter rules for citizens who are people who are here legally, LPRs, but they're not citizens. So right now, a lot of those, depending on their status, they can be eligible. if they're like a refugee or a trafficking victim, those kind of things, but a lot of those are changing also. So we don't have any guidance at this point as how many people that will cover. Next slide. The implementation timeline, right now, we are looking at November of 2025 for the FNS work requirements to begin. This is subject to the state completing the automation that's needed. So if the state has the automation completed, we'll start this new policies in November. If not, then the implementation of that may be pushed back until they can get the computers up and running. The first change that we know of for sure would be October 1st of 2026, and that's when the non-citizen rules will begin, and that's also when the FNS admin cost increase from 50 to 75 kicks in. January the 1st of 2027, that's when the work requirements and the 6-month recertifications for Medicaid will begin. And then October 1st is when there is a provision in HR 1 that any state whose FNS program or SNAP program has an error rate, and this is the state error rate, of 6% or more has to fund 15% of the FNS benefits. In North Carolina, what we're being told is that translates into like the state having come up with $420 million a year to keep the FNS benefits just at the current level. Right, currently, North Carolina's error rate is higher than the 6%, so it's not looking good for the state, but we have a couple years to get that back in shape. Just FYI, for Cabarrus County, we're at 95.9, so we are good.
We are not contributing to the problem.
We
Just
are
making
not.
that very clear.
I'm very proud of that.
What causes the error rate? Like, what is, how
Yeah.
does that work?
The state quality control, they do a random sampling each month. They pull cases, they look and see was the income counted correctly, were the number of people in the household counted correctly. Basically, they review the case to make sure that the benefits are correct.
So what is the error rate?
So
What is that?
The state error rate is 10.4, I believe it is, right now. And so, yeah, we have some work to do as a state. They have hinted a bunch of different solutions, but, again, until they make some kind of decision, it's hard to even concept. We always like to point out when we talk about FNS about the economic ripple effect, because FNS, or SNAP benefits, are one of the, it's the biggest program used for economic stimulus. It's been used nationwide for a long time to stimulate the economy and to actually help get out of recessions. They will change the allotments and things. As we said before, in Cabarrus County, we are issuing like $7 million a year, $4 million a month, which we are looking at losing about 580-some thousand a month with these new policies. So that would equate to $7 million a year that we lose. When you look at the independent or the indirect ripple effect, and that comes from, you have to hire a bag boy, you have to hire a stocker, you have to hire a cashier, you have to hire a deli worker, a farmer, a truck driver, and all of those people get jobs through FNS, then they go out and spend money and generate more revenue. So that effect would be another 4.6 million. So we're looking at a possible annual loss of about 11.6 in our economy.
Mr. Chairman.
And I don't want to sound insensitive at all when I say this or not, but are we doing anything to get these people employed? Are we doing any kind of job fair? We're finding ones, can we not look at, screen and say, these people on it will be the ones who lose it? Let's start getting them in some kind of employment or something, or?
The FNS program itself has work requirements, but the majority of the impact it has is basically just referring people to other services like Division of, I can't remember what it's called now, Division of Employment Services, used to be Unemployment Office. But mainly our effect is just being able to refer people to those places. That's all we really have at this point. Yeah.
Do you think that's something we should explore as to,
There is a provision for, we call them ABODs. Those are those people who fall into a certain category and they can only get 3 months out of a 3-year period. There are some things that will exempt them. Like I said, they got rid of the veterans exemption and the other stuff, but people can actually volunteer. As long as they volunteer somewhere for 80 hours a month, they could continue to receive benefits. If they work at least 80 hours a month, they could continue to get benefits. So we go over all those requirements with people, and if they show an interest in trying to do that, we'll work with them to try to find a local church or something like that, or the Goodwill or somewhere that they can volunteer for those 80 hours.
so again, not to come across insensitive, just asking, why do we just limit them to a job at 80 hours a month just because they can qualify for that? Why don't we find them a full-time job
Well, I
and
mean,
get them
that,
off the thing?
we don't have the specialists in the employment services. That's why we refer them to the employment office, because those are the specialists in that.
But do we train them, or when we talk, I don't know what you do, so. When we meet with these people, we talk to them, we explain this to them, are we explaining, hey, all you gotta do is find a job 80 hours a month? And then you
Well-
can get your benefit, or do we explain, look, this is your benefit, you go out and get a job, you're gonna have a better life
Yeah.
right
Well,
off the bat there.
We're required to give them the regulations, which
Okay.
do state the 80 hours. That is a federal requirement that we have to go over those with them. So we do say that, but, of course, when workers are working with people, they give that kind of advice, Go to the unemployment office, they'll help you. That's what they're there for, and they will encourage and as much as they can.
And I think the majority of people would want to work and do that. And there's some that can't, but then there's others that just take advantage of the system.
Well, and it's not widely known, but approximately 80% of the FNS caseload works in some fashion or another. It's
Right.
just most of them are underemployed.
Gotcha. Okay. Thank you.
Mr. Chairman, going back up to page 13, I've been wanting to make some comments on that. Work requirements are important for people who are able to work. They should be required to. Ones who can't, we should definitely take care of. No question about that. As for Medicaid expansion, that was being discussed when I was still in the State House. I left there at the end of 2022. And poor Tim Moore had to keep going to Phil Berger and telling him, I can't get that through my caucus, they won't do it. And part of the reason was what they were wanting to do. I don't know if anybody remembers this, but the income limits to receive, to get on the Medicaid expansion that they were offering in 2022 was up to $140,000 a year. I've never made that in my life, and I don't want Medicaid, don't need it, not going to ask for it. That was ridiculous. That's part of the reason we wouldn't go for it in the House. Plus, committee that was looking at this, I went to some of their meetings, and we had a number of people from other states who had already done the Medicaid expansion telling us their experience. And they said, yeah, the federal government's supposed to give you 90% of the funding, but after like 3 years, they just quit giving you that funding. So the states were getting stuck with that anyway. Plus, the thing about illegals. The only thing we should be giving somebody who's here illegally is, if they commit another crime, because that's a crime, being here illegally. If they commit another crime, let them serve some time in jail, but then the only thing we should be giving them is a trip back where they came from. And they wanted to put them, that's part of what the shutdown's about right now. Some people wanting to put people here illegally on Medicaid expansion. How much is that costing us if we do that? But people who I would say have better sense are saying no to that. And we need to keep saying no to that so that we have more to help the people who really need it, who are, citizens or legally here and actually have a real need. And if you can work, to me, that doesn't mean you. At least if you're making I don't know what you call a decent amount. I'm, like I say, I've never made 140,000, but I have been as low as about 30,000 or lower, and I never asked for Medicare or anything. I worked. So I'm a little sensitive about this. I definitely want us to help the people who can't help themselves, who are citizens or legally here. But for illegals, I got no sympathy. And people who refuse to work when they can work, well, I can tell you what the Bible says about that. The Apostle Paul said, anyone who will not work, let him also not eat. So that's my take on it. They did pass Medicaid expansion the year after I left here in North Carolina, but I can't recall what the income limit was at that time, but it was 140,000 when they were trying to do it before. And so we stood firm against that. So let's do this thing, let's do it right, and let's don't let people take advantage and take away resources that people who can't work need. That's my feelings on it.
All right, well, we will go ahead and continue with the presentation. I think we are up to Heather now. Heather,
Next slide. There we go.
there we go.
Oh, one back.
Heather, please introduce yourself as well, because I don't know if I did you justice.
Okay, so my name is Heather Altman. I'm the Program Administrator for Medicaid. Thank you for having us here this afternoon. So I want to talk about the impacts to Medicaid. We've talked about the impacts to FNS, kind of to the local economy. And so for Cabarrus County residents, we do have a little over 12,000 that are in that Medicaid expansion coverage who are potentially up for losing or a decrease in comprehensive coverage of healthcare coverage. So they would not necessarily lose it. It could decrease to a non-comprehensive coverage, which only offers one annual exam per year. But there's a little over 12,000 that could potentially lose that healthcare coverage. As far as the economy, we've already talked about the doctor's offices, the emergency departments, the hospitals, behavioral health, dentists, our local health alliance. It equals to $6.55 million in loss of expenditures that are going out to these doctor's offices, hospitals, because we average about a little over $546,000 per month in Medicaid expansion expenditures out into the community. And most of those are local dollars, such as we see at our Health Alliance. But it's a total, the total impact has a significant strain on these providers. Again, the hospitals, the doctor's offices, any dentists, behavioral health. But that also affects the pharmacists, any of the labs, and that could equal to, we've already talked about, a loss of healthcare jobs with that loss of funding. Next slide. This next slide, we talk about the public assistance benefit churn. That's in SNAP, Medicaid, really in any of our public assistance benefits. And what that is when individuals temporarily lose their benefits, and then they regain access to those benefits. And it's not necessarily that it's a change in eligibility. They run into administrative hurdles, such as missing deadlines. They weren't able to get their employer to sign off on their employment verification in time, should work requirements come into play. Or they weren't able to get some of the other type of verification. And they lose their benefit, and then they come back and re-enroll, and it creates this cycle where they start receiving the benefit, they run into this administrative hurdle, they have a loss in benefit, they come back and do a re-enrollment, and so it's a continuous cycle. That creates a hardship for the recipients, and it creates an administrative cost for the agencies, because that's more work on the staff members that have to enroll the customer or the recipient, work with them on the administrative piece, tell them that, they're losing that coverage, and then re-enroll them back, and it creates this cycle for both SNAP and Medicaid. Next slide. Okay, and so we want to talk about the frontline impact, and we've already talked about several of these, but there's the increased caseload complexity, double Medicaid reviews, and more client appeals. So when we say increased caseload capacity or complexity, we're talking about the work rules and the work requirements that creates more work on staff, more documentation, more follow-up with the recipients. Double Medicaid reviews, this is talking about the Medicaid expansion population. That's the population would move to the 6-month reviews. And that creates double work for that caseworker on that case, the individual case. So they're going from 12 months to 6 months. And so instead of touching that case one time, they're now touching it twice that year. And then more client appeals, when the benefits change, whether it's they lose the benefits or the benefit reduces, or we are denying applications, that leads to more discussion from the caseworker to the recipient. There's more appeals, time-consuming hearings, and it doesn't just take the time of the caseworker for those hearings. We then have to have a hearing officer, whether it be local. Medicaid begins with local hearings, FNS begins with state hearings, so it's, if it's a Medicaid hearing, now we have 2 staff members, plus someone to swear them in. So now we have 3 staff members that have been brought in for these hearings because of these changes. And then same thing with FNS, that we have to bring the state person in, plus the local staff person, plus a second local staff person. So it's not just one staff person that is affecting and having to do these administrative things. It's 2 and 3 staff members that are brought in when it comes to that hearing. As far as the financial strain on the county, I'm going to talk about FNS. With the increased workload, there comes a higher direct cost to the county because of the FNS share increasing by that 25%. So going from the 50% reimbursement to now the 25% reimbursement. So that increases the cost on the county. Next slide.
When does that actually hit?
So we anticipate that we will see our burden of share regarding the administrative cost to increase a year from now, in October of 2026. So again, that's one of the reasons that we are bringing this to your attention now, as we're in budget planning season, because this would affect our fiscal year 27 budget. So I do want to make it very clear that the state has not definitively said that this cost will go to counties, but we anticipate that it will come to counties because currently the cost share is between counties and the federal government. The state doesn't pay a dime in the administrative costs. They do cost share on the benefits end, but not in terms of the administrative costs. It's between the local governments and the federal governments. So if the federal government is only going to be paying 25%, it's a reasonable assumption that the counties will be paying the additional 25% at our level. So that's where we're getting the 75-25, and again, we anticipate that that will go into effect in fiscal year 27, starting in October. So the first quarter of fiscal year 27, it should be 50% reimbursement. Starting in October, it would shift to the 25% reimbursement from the federal government. And then overall, as Robert alluded to earlier, if a decision, the other potential decision that could be made is the state, in terms of their share, which would be that roughly that $420 million, that's probably the highest number. It could be lower than that, but that's the number the state has consistently given us. That would be their cost share for the benefit side of FNS and SNAP. So if they say, hey, that's just too expensive for us, then they could make a decision where we just wouldn't have a SNAP benefit program here in the state of North Carolina. So that's a scenario that could play out as well. Not saying it's going to happen, but it's one potential option. Did I misstate anything there? Okay. Next slide, please. All right, and so this is just the guiding questions for us in terms of social services. We are answering these questions for us ourselves. The program administrators here already talked about the increased caseload requirements for each of our of our caseworkers on the FNS side. So their caseloads and workloads will increase, although benefits will decrease. So that's something that we are planning for, again, beginning in the next fiscal year. And then also continuing to educate the community about all of these changes. Even though there's been a lot of attention to a lot of these matters, sometimes, when you get down to an individual, they just don't understand fully how all of these changes are transpiring. So we plan to do a lot of community outreach next year so that we can explain all of these changes and what implications it will have for individuals, for families, for children, and our community as a whole. And with that, I think we are finally to the end of our presentation.
Got one question.
Yes,
Do we have suitable staff to do that caseload?
that's a great question.
You want to answer, are you ready?
Well, for my area, we don't currently really know because we've never had work requirements for Medicaid. That is something we are looking into. We may not, depending on what the requirements are for the work requirements as they're laid out, because they could be different from FNS, they could be the same. It depends. You know, staff currently are at maximum capacity with the cases that we have. With the 6-month reviews coming, if Medicaid expansion stays, and them having to touch reviews twice a year instead of once a year, that doubles that casework for those 12,000 recipients. We may need some more staff.
And also, and I know, like, a lot of this is, we don't know what's gonna happen.
Exactly.
But I do think we need to point out too, that the reason that we're having to do a lot of this is because of fraudulence that's going on within the system. And what we haven't talked about is that those folks that have been committing fraud that are in the Medicaid system, that will no longer be able to qualify. And so we will lose those recipients. Therefore, the folks that are working on those cases may have less cases that they have to work on, even if they are having to check those job benefits every 6 months as opposed to every, or checking all of that information every year as opposed to every 6 months. If you have less people that qualify for it, then you will also have a less of a workload.
Yes.
So I understand that all of this is kind of up in the air, but to Commissioner Pittman's, examples earlier, the reason that we are having to do this is because we have paid out way too much money for people who are able and just not willing. And that's in no way to be disrespectful to those who truly, truly need it. That's what I want to help with. That's what I think Commissioner Pittman was saying that he wants to help with. But we've got to get a handle on this, and the only way to do that is to make sure that we have these processes in place. And it might look ugly for a little while, but we have to do this because it's unsustainable. It's unsustainable at the rate that we're in right now.
So we do anticipate a reduction in caseload, regardless of whether or not it's due to fraud, but we do anticipate reduced caseloads overall for both
Yeah, but
programs.
we also talked about that churn, though. Even though we may have a reduction in caseload, if I go have a change, I come off Medicaid or SNAP benefits, and I go have a change I think is a change, that person comes back in, to see if they may be eligible, and it just is a continuous cycle. Whether they are eligible that time or the next time, the next time they are able to come in, they could apply every day if they wanted to, and that affects staff, more work on staff trying to go through those applications.
And there's also increased complexity in the policies too that takes more time to.
I would like to go back to the FNS, and I'll need Jim Howden to come up here. I have some questions, please, because I refuse to accept that posting a couple of resources on our website is the best that we can do for that. We sit in these seats and we're able to make these decisions. Jim, if I remember correctly, every year you do a finance director's presentation. And last year, you said that we set $5 million aside in the fund balance in the general fund for unknown things. Is that correct?
That is correct.
Right, and I would say this is an unknown thing that we're dealing with. So with that being, what happens to that money if we don't use it?
I keep rolling it each year.
Okay. And from my understanding, we've received communication from the UNC School of Government specifically citing General Statute 160D-1311. And what that does is they're given guidance that it allows the local county governments to fund assistance programs, and it also allows us to administer it, but it cannot go to private entities. It has to be like a 501c3. Is that to your?
That is my understanding.
Okay.
Yes.
So I've checked the website. I've seen the ones that we do. It was said here tonight, 24,000 Cabarrus County residents rely on SNAP, and 47% of those are 17 and under. Whether you're able-bodied or not, we share some of the same opinions, but the kids, that 47%, they can't help what their parents do. And those are people that are actually going to go hungry. So with that being said, I would like to make a motion, Kelly, that we allow the county manager to access the funds, $1 million. I'd like to start it at $1 million, see it for a month and see what happens. We don't know when it's going to be reinstated. We don't, but set that progress for a month and revisit it again next month. But I would like us to split that $1 million between Cooperative Christian Ministries, One Can, Elder Orphan Care, Salvation Army of Cabarrus County, the House of Hope Operation Breadbasket, Concord Christian Church Second Harvest Pantry, and the Second Harvest Food Bank of Metrolina. Like I said, we set aside $5 million each year for the stuff like this. We have it. It's not going to affect the tax rate. And if we don't use it, it's just going to roll over. So we sit in the seat to where we can actually supplement that, because they're only going to get half of their benefits. And this is an issue. Maybe next month we have to look at WIC. I was unaware that WIC is done at the end of this month. But I would like to make that motion that we allow the county manager to access those funds up to $1 million to be spread evenly across those 7 organizations.
Okay, we will need to get a suspension of the rules.
Okay. So I'll make a motion to suspend the rules.
All right, we have a motion to suspend the rules. We have a second.
I want to know more about it before we decide to
That's
do
fine.
this.
Can we discuss it a little bit before you?
I need to understand, because I want to, before, and I'm not disagreeing with the 17 and younger children. I understand they should not be held responsible for what their parents do or don't do. What I don't understand is how these organizations, and you named off quite a few, and respectfully, I don't know how they are going to take that money and make sure that it's going to go to the children specifically, and it's not going to be
Well, my motion is not just for the
used
children.
improperly.
It's not for the children. We can put the mandate in there that goes solely for the food, just for food to assist these organizations. But for me, at the end of the day, that's 24,000 people who are getting ready to be hungry. I don't care if they're able-bodied or not. That's 24,000 people here that could possibly not be eating. We have that money. It's set aside. If we don't use it, it's going to roll to next year. So it's not asking to increase anything. It's asking to use what we already budgeted for an unknown. For me, I'm not going to mandate that it just goes to the kids, because if the parents don't eat, they can't take care of the kids. So to me, it's a whole household. But I think we absolutely can mandate that money for those organizations goes directly to food. And the reason I wanted to do it for that is because according to that general statute, we have to have contracts in place. Those organizations already have the structure and everything else. The people that need that assistance, they already know of these organizations. That's who they go to normally every month. So it helps with not being able to reach certain citizens. They can continue to go where they need their help at. And that's where I'm coming from that.
And I get that. Here's my question. We've had this agenda in place, and I know that the benefits just stopped on Saturday, if I'm correct, November 1st. But this is a big ask for, I mean, again, we haven't even really truly discussed this. And, I mean, Kelly, what are your thoughts on this and Jim? You know, what are your thoughts on this? Because I don't know, like, this hasn't even been brought to, I don't want to make a rush judge decision on doing something that is going to not be, I understand in your mind, I understand that this is in your mind the right thing to do, but I want to make sure that we are doing something that is truly going to benefit.
It's not just my mind, but how do you put a dollar sign on people missing a meal at night? You've heard from these people who work in all these departments that this is absolutely happening. How do you put a dollar on that? I could say, let's do 5 million. I could take the whole 5. I started it at 1 so that we could monitor it and see how it goes. If they implement it back, great, we're done with the 1. I didn't ask for 5. That's why I started at the 1, because I didn't want to start off on the high end.
I would like your opinion on this, Kelly.
So from a standpoint of, we do have emergency funds there, it would be your declaration of whether you consider this an emergency. We have some experience with some contracts around this through the ARPA money. So I feel like we could probably get some contracts drafted pretty quickly and get those executed. We could restrict, obviously, as requested, it only be purchasing food, no personnel, none, nothing else, just food. It would just be up to your desire.
Can we restrict it in a way, okay, so we make up to 1 million available, but restrict it in a way that somehow they demonstrate it's from their shortfalls from feeding new people because of SNAP or because of this situation. Because what the troubling thing I have with it is we say we give $1 million, we hand them all this money, this problem gets fixed. And then, not that they won't do good with that money, but it's no longer addressing the problem that we wanted to address.
I suppose we could,
But I'm just thinking if we tailor it where, and I don't know how we do that, but we tailor it somehow, it's gotta be, we gotta fill the effects. We gotta fill the gaps until this thing gets in place.
Doug, if this problem gets fixed and that need is no longer there, is there a mechanism in place where we can get that money back that's not used?
Well, I'm making notes as you all are talking about
Yeah.
this, because I know you're just kind of floating around ideas. I mean, it sounds like what you're contemplating is wanting to structure it, and doing some contracts in a hurry wouldn't be a problem, but the notes I'm making are, no overhead, no personnel, et cetera, just for actual food or formula.
Yep.
For end recipients, perhaps, and I'm hearing you all talk about perhaps a requirement that the end recipients, it has to be documented that they are customers who lost benefits, because that's what you're talking about, is trying to make up.
absolutely.
Yeah, I'm trying to fill the gap
Yeah.
until it's
if you want to target this particularly toward children, we could
I'm
require a certain portion of
kind of
it
like
be-
Kenny though. I don't want to just
Yeah.
children because I'm in agreement too.
There's a large
Parents have
amount
gotta
of,
eat too.
there's a large amount of elderly that also depend on
Yeah.
Correct.
SNAP. So if we target just children, then we're leaving the elderly out.
We could focus a certain percentage of the money on formula, insure,
That's
things
fine.
that elderly or babies, small children would use, a certain amount of baby food. If you want to heavily influence it, I mean, hopefully the community will step up as well and be providing food, but we could wait because they're going to have to submit something to us showing what they purchased. And, if you're looking at whether or not you're filling a gap of additional demand, obviously we could get them to present their numbers for how many people they served last month, but we'd probably also want to see last October, last November.
Absolutely. They should have to come sit right here at the next work session or whenever that goes into effect and tell us exactly what they use that on.
There's some rails that we can put in place that would help with that. They would purchase that and then we would reimburse is typically how we do that. We don't typically hand people a check first.
We want it to be a safety net, not a handout
Right.
type thing.
So there are some things that we could do down that vein, if those are guardrails that you prefer, or however you would want to approach that.
Do we need to put those, you go ahead. You got your microphone.
Mr. Chairman, I kind of feel what Commissioner Wortman's talking about, and I understand not wanting to hold kids responsible, their parents should be held responsible. Sounds like maybe a good idea, but I'm wondering, would you be okay if we move that to the regular meeting this month instead of doing it tonight? so we could discuss it more and have a better idea how we're gonna do it.
How big of an impact would 2 weeks have?
It's difficult to predict. Again, we anticipate that beneficiaries will receive partial benefits. We just don't know when. Because as Robert mentioned earlier, the first disbursement would have happened today, and obviously it didn't happen. And then it's on a 2-day cycle all the way up through the 20th of the month. So we just don't know. I mean, because, again, this is a decision that literally just came down today. So we just don't know, and we haven't received guidance yet in terms of when people can start to expect the 50% benefits on their EBT cards.
If Kelly can get us an email, I know I dropped this on you guys tonight, so if Kelly can get us an email and communication within the next 2 weeks to show the guardrails that we put in place, would you guys then be in a position to vote on it at our regular meeting?
Yes.
Is that fair to say?
No, that's absolutely
And
fair.
I expect to support it, but I want to be a little more sure about it. And who knows, they may get things straightened out in DC, and we don't need to do any of this, by that time.
I mean,
But
the goal-
I doubt it, but we'll see.
The goal that you have is, I get it, like, we totally, I understand that, but yes, you did, I respect what you're wanting to do. I just want to make sure that we have, to your point, Kelly, what we have in place is truly going to benefit the folks that really are going to need this moving forward. And
Need to make sure we do it right.
Yeah.
Right, is there a preference for it to be weighted toward?
no, and
Anything.
no, I mean, I knew what you were saying about the children, and I agree with that. But I also know that there's a lot of elderly folks that are on it as well that are not capable of working, and they, they utilize these benefits. And
Maybe Elise, in the next 2 weeks, you could reach out to these organizations and see what need is coming in the most.
Absolutely.
So we can address that.
Absolutely. Happy to do
I
that.
personally would rather do it tonight, but I can, because my worry is what happens in these next 2 weeks with people going hungry.
well, my
'cause they're-
hope is that the community will step up too and do the donations, to try and help, and that the folks will reach out to these organizations. And hopefully they will put some things on their websites of things that they're needing, so that, everyday folks in the community that want to help can start distributing some of those items to those organizations, Cooperative Christian Ministries and One Can and all of those.
Because, like I said, I wanted to do it tonight, but if you guys think, if we get these emails, you'll be in a position to where we can vote on it at our regular session, then I'll compromise with that. But what I don't want to see happen is it get pushed off another 2 weeks to
No,
our
I-
next work session.
No, I agree.
And then another
I agree.
2
I agree.
weeks.
I don't want
So-
anybody to go hungry either. I don't think anybody wants anybody to go hungry, so.
We will draft.
And-
I'd like to
rescind
see us add it to the
Okay.
agenda for the.
Motion's
regular meeting.
withdrawn.
We will
We'll add it to the agenda.
But if we can see some emails with the organizations and then the guardrails, because I would like to be able to vote on this so I guess we'll add it for new business at our regular session.
And I feel your pain about wanting to do it tonight.
I think
Just-
the 2 weeks will give us time to know exactly how's the best way to implement it when we do. I mean, we got to make sure, I'm concerned it goes to the right place.
Well,
It
and
gets to the people we want it to get to.
it would give us a chance to find out needs so that we can make sure that we're actually hitting the needs that
Right.
are most requested or most needed.
We need to be efficient about it.
Yeah.
Yeah.
All right, we will work on that. We'll get some information from them and get some information out to you on some guardrails. In the meantime, Doug can be kind of getting some drafts together to see
I've got 2
what we
pages
can-
of notes here. I'm almost got a copy.
what we can do with that. All right? Fair. Thank you.
Thank you.
Thank you for the opportunity to present. We appreciate it.
Thank y'all so much. All right, now we're back to the fair.
Yes.
All right, we are on the fair. Step on up.
Good evening, and thank you for having us.
think you're on the last slide. Quick preview in reverse there. That's good. Hey, so we came before you in September to talk about how the fair ended, and tonight we promised then that we'd come back and share the numbers with you. I want to turn it over to Courtney. She's going to talk about how she pulled together a fair in 5 months, because that's how long she was here. If you guys didn't realize that she had only been here 5 months before we started the fair. Congratulations on pulling it off. And I think we've got some interesting numbers to show you, and we'll walk through it together.
Okay. You can go to the next slide.
I guess I can click it here, don't I? Sorry.
Okay, so first off, we're going to talk about the rodeo. You can see what our expenses were for the rodeo, what we paid Southern Rodeo Company, the dirt for the arena, and then also arena labor. Then our revenue with ticket sales, concessions, something that we were not expecting, and then also sponsorships with a net of $65,824. So it definitely did well.
Yeah, it paid for itself and then some, obviously. And I think there were some questions on, what was going to happen with the arena and the labor on that side. So that's what that number is. I think Commissioner Workman, you and I talked about that a little bit. So that's we broke that out specifically. You'll see some other, arena numbers later. Honestly, if you go back and look in our financials, it's all one number that we paid to the arena, but we broke that out so we could clarify that. And like Courtney said, the concessions number was a little bit of a surprise. As you'll see on the next slide with the numbers of folks who showed up, they were hungry. So we were able to make some money and sell some soft drinks to folks that attended that. So it helped offset, again, that number and help the rodeo pay for itself.
Okay, so these are our attendance numbers for each night. Obviously, our Saturday nights are better than Friday nights, with a total of 5,918 people. I feel like this could grow for next year. One lesson that we have learned is we started selling tickets online, advanced ticket sales. And in order to know how many we could sell on Friday night, September the 5th, we stopped sales the day before online. And what that created was hundreds of phone calls on Friday wanting to know if the rodeo was sold out, how do they get tickets if not. So that's something we learned that we're going to work out for next year and hopefully get those numbers even higher.
I don't believe it's something we have to vote on tonight, and then we'll be back before you next month with another contract to talk about. But we feel like this is something we would like to have Southern Rodeo back next year. Obviously, it made money, and we feel that it really improved the draw to the fair. So we're going to continue those conversations with Southern Rodeo and get the contract either in front of the county manager or bring it back to you guys, depending on what the requirements on.
Well, I was going to say, and I was going to turn my microphone on, but it's not working, so. You got,
There you go.
okay, thank you. The rodeo was awesome. That was literally my first rodeo, and I thought it was very cool. I'm so glad that we got to do it. I did have a question, though. So I remember when we were talking about it previously, like the dirt was the bigger, like that was always kind of the caveat to why we'd never had a rodeo before. So I guess, what did you learn by that, and was it as big of an issue as you guys expected it to be, or less of an issue than what you thought it would be?
That's all you.
Okay.
You negotiated, you talked to
Okay.
those folks and got them in here, so.
Okay, so originally, the amount of dirt that was behind the arena in the back was used to do a show ring within the event center. It was, I don't know exactly how big it was, but they used that dirt to make the show ring. So the thought was that we weren't going to have enough dirt to cover the arena floor for the rodeo, so that we were going to have to purchase dirt. In talking to the rodeo company, they wanted a mixture of dirt and sand. And ended up, we had plenty of dirt to cover the arena floor. And we still had some left over even after we went up the ramp into the event center to make it safer for the horses and the livestock to travel down that ramp. So the dirt didn't end up being a huge issue.
If you're gonna continue to talk to them, are you gonna see if maybe they would be willing to lock in long-term, multi-year to keep them from raising prices on us? Is that something you might be willing to talk to them about?
I would definitely think we'd be interested in doing that, and I think the Brooks
They are
family would
too.
definitely, they liked our facility. They definitely want to do that. We have some challenges from getting, riders and folks here, so we're gonna, that sponsorship number is the area that we've targeted that we know we need to work on to be able to bring more talent to this area and make it a venue where folks want to travel from Oklahoma, like, one kid did, and they've got a good group of riders, but to really make it a destination location that's on their rodeo circuit. And I think, to your point, if we kind of advertise it as, this is what we're gonna do year after year, it becomes that destination.
Yeah, you have to, in that same time frame, we compete with a rodeo in Canada. So that's what takes some of the talent away from here. So if we get some more sponsorships, we can maybe draw them here. All right, so here's our revenue numbers for 2025. Our vendors are our outside food vendors, also the mercantile that we had this year, which was the inside craft vendors. We got $32,600 from there. Carnival receipts, those are our ride wristbands, $228,830. Our gate receipts, $291,000. That is the rodeo revenue number that you saw on the first slide. The miscellaneous revenue would be fees that we got off of the ATM machines that were placed for, cash only. There are more sponsorships. So these sponsorships here were just fair sponsorships. The ones that you saw on the first slide were specific to the rodeo. So in total, we had about $27,000 in sponsorships. Our parking fees, while, we don't charge for parking at the fair, the parking fees are when we settle up with the ride company for all of their RVs that are parked there for the week or two that they're there. And then also entry fees. We have several competitions that require entry fees. That would be the pageant and the horse and mule and donkey show. So that's where those fees came from. And so there's our total revenue number for 2025.
Added in 24 there just as a contrast, so you had some perspective to what that number looked like. It's obviously not apples to apples. There wasn't a rodeo to be able to compare it to.
Okay, here's your expenses. 2025 for building and equipment rentals, we're just under 90,000. Purchase services, we're at 498,000. And you will see what those numbers are or what makes up those numbers in the next slides.
It's basically the labor, the entertainment, and the rodeo is what the makeup of that big number is.
Yes.
So, and we have, like I said, you saw the rodeo, there's a labor and an entertainment slide that'll kind of break down, and we have some more detail on that.
Okay, our sheriff's deputies that covered the fair were 135,000. Building and grounds materials, just over 1,900. Fair supplies. And then our premiums, we paid out $28,478 in premiums this year. That was up from last year. I do believe that is because of our livestock shows. We had more participation in our livestock shows this year. Marketing activities, 1,600, and then our advertising cost at 30,781. And that gives you our total expenses at the bottom.
So it looks like we paid less in marketing
Yes, for sure.
than advertising, and
We've got a slide coming up on that. She's going to talk to a little bit more about that. So I just flipped back and forth to show, just because we had some numbers late there that, it's not a full break even, but it's pretty close. We were hoping to be in the black, over on the expenses, but we are a little bit obviously in the red. Is what it is. Attendance numbers. I'm gonna cover this. So as I forecasted it using the ShowPros spreadsheets that we get, some of the data was hard to track and follow. So I went with the dark blue line here represents the paid admittance through the years. And then so when I added that green line is 3,054 folks that came on carload night. And when if you looked at the spreadsheet and the documentation on the back end, we had to do the math on that, right? Because every carload ticket that we sold was 6 people. So had to extrapolate that out for the 3,054. And then the red line there is the 5,915 people who attended the rodeo. Everyone who attended the rodeo got access to go to the fair. Many of them did come over at least for a little bit, get a funnel cake or a corn dog or something and walked around. Didn't mean everybody went, but they had the ability. And then the blue line is that last 5,509 kids who showed up that we, on Wednesday night for the school night, as we call it. So, so that was the free admittance. So those are all things that we had assurance in that number from a ticketing standpoint. There's, we're going to work on it for next year. It's one of the things on our list as far as how the clickers go from, people coming in the back gate and all of that. So we're going to work on that. So just to be able to forecast it and show the data across, that was the safest number. So if you go back and look at some, you're like, oh, well, that doesn't match up to what we might have seen in the past. That's what this arc shows. And again, we just wanted to talk about the nights that were a huge success. You can see that Wednesday night in the middle of the week, the sheriff's office was able to step up very quickly and help us, with all of the parking requirements and everything that happened when 10,000 people showed up at the fair on a Wednesday. We were glad to have it. We were glad to see them show up, but it was a lot in a hurry, and so we had to pivot. That Saturday, if you remember, that first Saturday, we had intermittent storms. That I would say that 6,000 numbers propped up by the rodeo. So it was really thin out there because we had to stop the rides several times during the day there because of lightning and everything else.
What was that Wednesday?
That was
School
school night.
And the Saturday was
The first Saturday was,
10,000.
That's just historically been your largest day, yeah.
Everybody comes.
Carload was Thursday night. But that Wednesday, it worked out perfectly this year. The kids in school had a half day.
yes.
And
Yes,
and
we
I
might
think they
ask
got-
you to lobby Mr. Kopicki to maybe change their school calendar for next year to remind them that if we have a half day on school night, we get a lot better attendance. Our carnival folks really liked it. Even though that they saw a little bit of a dip from a wristband sales, but giving some of them away, they obviously made a lot of money on the food. This is the labor slide that we forecasted earlier, so how we did things a little bit differently this year using the arena staff versus, paying third-party labor. I think Commissioner Workman, you and I discussed that at one of the meetings, that how we were going to offset that, and you can see that there. Anything else that we wanted to highlight on that one? Our ShowPros number is a little bit higher.
Yeah.
We're going to work on that too. So.
I'm just going to point out too, in case anybody, I'm sure there's not anybody out there that's looking at this online from what we had on the county page originally.
Yes.
But if there are, this is an updated version than
Yeah,
what we
yes.
actually
Yeah,
have
sorry,
out
the-
there
yeah,
right
this-
now.
This last slide was completely wrong. So if it was with what I published and then I caught, I'd already.
I just wanted to make sure
Yeah,
that if
sorry about
anybody
that. I
was looking at it, then they knew that we've
Yes,
updated
sorry.
it since this
Yes,
came out.
absolutely.
So
No, Ari saved me on that and was able to get the right slide in here because this was, I had messed this up pretty good. And then this number may be new as well because we were able to get the sheriff number in there from payroll. And then in '24, that number wasn't there, so we're working through that. Give me a little assist, sorry.
Okay, so here's our entertainment for 2025. We spent $136,350 in entertainment, which is quite a bit higher than 2024. You see some of the pictures of the entertainment from this year. As far as going forward for next year, we won't have an entertainment number like that. There are some acts that are already booked that we won't be able to get. But also, we just don't have room.
Yeah, I think there's just a different approach. I think we pulled out all the stops this year to look at a couple different things, and I don't think that it made a lot of sense to do that many different shows. It was a little stressful, to say the least, on the day that we were setting up the schedule and trying to put everybody in their spots to make sure we had a good layout. It worked out. I think there was a lot of people walking around looking for different acts and wanting to find the shows. So it was positive, but our fairgrounds isn't big enough to have that quantity of shows.
Okay, so here's the premium slide. I wanted to highlight this. We've already talked about premiums earlier, about how we paid out more this year. I do believe that's because of the livestock shows. But you see here our 2025 Adult Best in Show winner in her quilt, and also the Youth Best in Show winner with her crocheted quilt. We took these items to the North Carolina State Fair, and they have a class for any county fair to enter their Best in Show items in, and our adult won first place at the state fair. So that was pretty cool for us to get recognition there.
With the winners, I know with cooperative extension, one of the things that they had talked about was a way to maybe showcase the winners more. So is there a way, Todd, that we can
Get this stuff on the website.
maybe get online? And,
that's a good
because I know
idea.
that was one of the things, was they put a lot of work into that. And if we could somehow just either put it on the TV or put it on,
We actually had the Fair Advisory Board meeting last week, and that did come up from the folks who ran Gold Hall and said, hey, there's a lot of photographs, a lot of great stuff online and our social media that talked about all the rides and the rodeo and all the great things, but we may have missed some of the gold that was in Gold Hall. So we're definitely got that on our radar for next year.
I don't know if this is what you're asking too, but Extension does make signs that tells in each department who won. Is that kind of what you're talking about, or
yeah, kind of, but they also wanted it a way to just kind of
Put it
continue
out.
to advertise
Yep,
it, just
yep.
for a couple weeks after the fair, maybe
Yeah.
online, or, hey, these people won the livestock, just a way to showcase it.
Oh, I definitely want to promote it because I want to get more entries as well. I think that's the only way you do it, is if you don't have, it's a diminishing group of people that even are aware. And then our fair is different. You don't have to live in Cabarrus County to actually, bring and submit things into the fair. So we accept entries from our surrounding counties, because, Stanley, they don't have a county fair anymore. So that's another thing we're going to focus on, is trying to draw some more of those folks up into this area.
Could they do, to that same vein on channel, is it 22
Yeah.
that we have?
Weaver's team has done an amazing job, and we'll have probably a ton of video and stuff for us to promote it going forward. So I think that's going to be something we highlight here in a second. Do you want to talk about livestock?
Yeah. So I said earlier, I think our premiums went up because of the livestock shows. Here's just a couple of pictures from inside the arena where they were able to show. Also, the youth showmanship belt buckle. We gave out belt buckles this year instead of trophies. And when you talk to children, a belt buckle is a big deal. So I think we will definitely continue that. Just to give you some idea, last year in the beef show particularly, because I participated in the beef show, there were 23 beef cows in the barn, and this year there were 36. So we increased it. And now I can't tell you what the numbers were last year for dairy, but I know we increased all the shows. Okay, and this is our advertising this year, and Laura said she saw the difference in number there. We spent $30,781.53. You see some examples of our billboards and ad panels that were at Concord Mills. We focused on radio ads, gas station ads, so ads at the pump, a lot of social media, billboards. We did some social media influencers, and then the ad panels were something new that we tried this year, and felt like it went really well. But Jonathan and his team did a fabulous job with all of the advertising and getting things put together for that, and I'm so thankful for them.
And I was gonna, look,
Yeah.
it ain't coming off,
Yeah.
the sticker, so it's there for advertisement forever. I love the stickers that y'all did. You passed them out at the Mount Pleasant Parade. I think we ran out. So I think that was great advertising.
Did Jonathan's team design that on that previous slide? Did they do that rodeo? Did they design that?
I don't think.
I think they have a contractor they work with that help them through that, but I would definitely put most of that on Weaver. He has the eye.
We're gonna claim it.
Well,
I mean, I know that because it was that was our first focus, right? That we knew we had a short period of time, so we needed to get the word out that we were still having a fair. So we wanted to make sure that got out quick, and we worked with some folks. And Weaver, he's really quiet, right? Yeah, not when something doesn't look good.
it's
If it doesn't look good, he let us know, and he was great, and I loved it. And he's like, no, we're not doing that, and so his fingerprints are all over that, whether he'll ever admit it or not. But I think it was amazing.
that was what, when you're in Concord Mills and you're walking around where the map, where you can see where you're at and where everything is, that's where those were. So,
That was our final slide, just to kind of catch the feel and the vibe. We were able to crown a Miss Cabarrus County Fair and a Little Miss and a Junior Miss, and I know I'm messing
the
all up,
misses.
and Jennifer Boss will text me in a few minutes and tell me I got it all wrong. But we really appreciate her work too, bringing that back. I think that was a lot of fun, and hope to grow that again next year. But you can see the petting zoo there and kids showing the animals. So I think that was, we got a lot of feedback that group, we love Powers Entertainment, and they have great rides, and they brought in fantastic amusements. But you can put that stuff up almost anywhere and draw some folks. But we really had the vibe of a county fair, because we had the livestock back, and we're able to bring it all together and really pulled off a great fair, I think. I know this has been great because you guys have been interactive in the middle and didn't save all your questions at the end, but was there anything else that we missed that we should have brought to you?
No, I just want to say thank you guys again. I mean, you guys did an amazing job. I think we all know that. This is the best fair I've ever been to. I can't wait till next year. I know you have lessons learned from it, but it was fantastic, and thank everybody for all of their hard work. It was great. So.
Tons of volunteers. I wish we would have tracked that a little bit better. I know that Court's got a few numbers as far as volunteer stuff.
We had 32 volunteers this year, and a total of 1,966 hours that they worked. So they were fabulous. They were wonderful. I can't wait to have them again.
One question, but number one, I commend you to pull off what you did in 5 months. Everybody I talked to said it was amazing, so congratulations. Just out of curiosity, for the rodeo, the allocation of the money, so, because when they paid for that ticket, that included the entry to the fair. So did we allot the whole 20 to the rodeo, or did we break it like 12 and 8? Just out of curiosity.
We didn't. I did the math on it, thinking the same thing the other day, just like, because if you looked at our gate revenue, and I was like, well, if you took the $8, so I think our total net on the rodeo was 67 some odd thousand. If you took the number of people who attended the rodeo, 65, and if you took the total number and times it by 8, it's like 47,000. So yes, we didn't show that here, but I did do the math on the back end, thinking the same thing. That was like, so
I was just curious.
yeah.
Good
And
job.
we're going to definitely track it differently and try to streamline that. If you were there on the last Saturday night, the line was crazy because everybody wanted to go from the rodeo to the fair because we stayed open till midnight those nights. That was a different change. So
Quick question, on the ticket sales, is there any other costs going into those?
as far as right here,
Yeah, because if you do the simple math, that's the reason I'm asking, is if you do the simple math, it's not adding up
For the number of tickets that were sold.
for the number of people versus the tickets.
So that ticket sales number has also box seats in it
Okay,
that,
we sold a couple of
yeah,
those.
we didn't advertise box seats or
Okay.
to sell the boxes. but
And I
that
think
has
that
been
also
advertised.
subtracts out the cost for e-tics in there, so there's a little bit of math. I don't know if we calculated that in that number, because we did sell some tickets online.
okay, we'll get a breakdown of that so we can
Yeah,
follow up.
yeah, we
with it.
definitely,
Yeah.
we'll task Jim with that number. He's the accountant.
Yeah,
We put on the fair, we'll let him count the beans.
Yeah, we'll-
Yeah, he loves it. We met with him last week, and he's like, yeah, it looks good, so, yeah.
We'll circle
close.
back with you on getting that allocated out to box seats and all of that.
Sounds great. Cool. Thanks.
All right, discussion items. We have boards and committee about care home community library committee appointment. Anybody got any discussion on it? Can we like consent agenda? Two, fireman's relief fund trustees appointment. Anybody got any issue with that? Or does Jacob want to tell us what he's doing?
So just a little background on this item. Each rated fire department in North Carolina qualifies for the North Carolina Firemen's Relief Fund Board or Relief Fund Program. It's created back in the Depression age to help desolate firefighters and their families in times of need. But each fire department has a local relief fund board that controls the payouts of those. Part of the state law is that part of that board is appointed by the local board of commissioners or the municipality depending on where that department lies. And so these are the names that are submitted by the fire departments for appointment to that board.
Anybody have any questions? We move that to consent agenda.
Thank y'all.
All right, next is Boards Committee Juvenile Crime Prevention Council appointment. We have anything on that?
I asked to put this one back on. Ingrid Nurse reached out to me after our last meeting, and kind of asked, she'd like an explanation as to why she was denied. She met all the requirements. She went and did the presentation. Their board unanimously approved her. She's not served on that board, so therefore she doesn't exceed the time requirements. And we had approved everybody else. She said she was kind of embarrassed and she felt like she needed an explanation as to why it was not approved when we approved everybody else. So I asked for it to be put back on this agenda so that we can try to get her an answer.
So I actually have an alternate suggestion after going through the applications. And I spoke with her earlier today, just to confirm that she was still interested. Henrietta Jackson, who, based on her application, after going through the applications, is quite qualified to serve, and also stated that she sent this application in 2 years ago to want to serve on a committee for the county commission, and has not been able to serve at this point, and would like the opportunity to be able to serve in this role.
I've also talked with Henrietta, and having read through the applications prior to last month's meeting, of all the applicants, I mean, there was some good stuff, but she was the best. She was the most qualified, education-wise and professional and civic. Plus, instead of 10 hours per month, she was offering 30 hours per month, on top of being, I felt, the best applicant after reading the application. So I intend, and I think Commissioner, I started to call you Representative, Commissioner Lindsay, we also intend to put Henrietta on the thing for, whenever we vote on it, we'll vote for her.
And she did attend our meeting and presented that day. I will say JCPC does have a good problem that we have a lot of people interested, so we always have a lot of qualified applicants, so it is hard to make those decisions. So, I mean, she is qualified, she has shown up, she has participated, she is one of the people that made it through our membership committee process. And, you know, it's obviously y'all's decision as to who to seat on our council, and, I mean, our interest, I think, is having a full council, and we have had some vacancies recently, so whenever we can seat people, we're happy to do so.
So in that regard, I'll make a
Wasn't
motion.
Ingrid unanimously approved by your council?
She was nominated from the floor. I mean, we did have a lot of discussion, kind of going back and forth. And again, in the membership committee that met earlier, we didn't feel like we could make just a single recommendation out of the people that were interested, because again, we did have so many qualified people interested, and again, qualified and have skills that are related to what we do on the council.
I don't know if you can do it tonight or have to wait till the regular meeting, but I do intend to nominate Henrietta Jackson for that position. I don't know why they didn't choose the best, and Henrietta's obviously the best from what I've read and from talking to her.
I'd like to go back to JCPC and make sure how they would vote on her.
We have our next regular meeting, I believe, is the Wednesday after the regular board meeting. So that would just leave us with that seat vacant until December. Although we typically don't have the December meeting, our next meeting after that would be the January meeting. But certainly we would be able to have that done and ready for your December meeting. It's my understanding that if a council member is not approved by the board, then that action ends for us, and that we would have to move to new nominees anyway.
So if it's your desire, we could put it on the December work session and you can suspend the rules then. I don't know if it's necessary or not, since they're probably not gonna meet in December, but,
That's fine. I just want to take it back to the committee because I think they have to, because they didn't send her up as a nomination, did they?
No, we had just sent up the student seat that you approved, and the other at-large of Mr. Young that you approved.
Yeah, I think based on your bylaws. All right, so you'd have to send her up. Okay.
And I mean, and certainly I could communicate to the council, your interest in having Henrietta in that seat.
So based on your rules, since Ingrid was denied, she's no longer, you can't bring her back to us anyway.
That was my understanding in speaking with our area consultant.
Well, if that's the case, there's no need to wait. Because your goal is to have a full board. Ingrid was the one that was nominated, which is why I went with that. But if what you're saying is that's out the door at this point because the bylaws, then there'd be, all you're gonna do is stick them with an open seat for 2 months. So,
well, we can add this as the agenda item with her as the recommendation and move forward if that's the desire.
Well, I was thinking we'd do it at the regular meeting this month.
Correct, yes.
Okay.
And
We
that
can
would,
make
that
that
would be
adjustment.
before our next, regular meeting,
We
so
We
that would
can make
allow
that
them.
adjustment, add that to the agenda session, or into the regular meeting for you.
Okay.
Would you like that on new business or consent, given that?
Put it on the business.
Okay.
Yeah, I don't want to stop anybody from being able to discuss it if they want to, so putting it on business is fine with me.
Yeah, just put it on business.
Okay. Thank y'all.
Molly had to leave, so if there's any questions, Molly had to leave, so if there's any questions, I can.
Oh, okay, I got you. All right, next is the Youth Commission appointment. Molly left, so do you want to, anybody got any questions on that one? Can we put that on consent agenda? Okay. 4.5, same thing? Perfect. All right, 4.6 is a removal. Anybody got any issue with that? Put that on consent agenda. 4.7, request for right-of-way and easements. Kyle?
Good evening. Cabarrus County has been approached by the land development and traffic engineering firm representing the adjacent owner to the Cabarrus County-owned property located at 2892 Zion Church Road in Concord, North Carolina. That is the property that we have slated for the future animal shelter. The adjacent owner would like to be granted certain right-of-ways and easements. This is our engineer, the engineer for that adjacent property, Joe Wilson, with Volkert, if I'm pronouncing that correctly. And he's going to go ahead and present the attachments of what they're asking for in terms of the easements that would affect our property.
Yes, as he said, I'm Joe Wilson. I've served this community for 36 years now. I've been the traffic engineer for Concord, NCDOT, and a consultant for Concord and Cabarrus County my entire professional career. Basically, Rick Alexander, Ready Mix Concrete of the Carolinas, a local-owned small business, purchased this lot right across from Latimer Lane on Zion Church Road with the goal to build a concrete plant to provide concrete for the development that's occurring in this area. He paid for his site civil engineering. He went through the city and the NCDOT. He did a traffic impact analysis, and as such, the DOT and the city required that they build a right turn lane and a left turn lane for their driveway, which is directly across from Latimer Lane. as such, in order to have a driveway and do the widening, they have to widen on each side of the shoulder. In this particular case, they did 8-foot widening on the other side of the road and only 4-foot widening on the county side. But they have to put a right turn lane as well. So when you build a left turn lane, you basically widen the road 6-8 foot each side, and then you pave it and restripe it as a turn lane, and then it tapers back into the existing 2 lanes. So from their driveway, it would go approximately 250 feet to 0 on the county property. Now, they also asked for a site easement. And on this, it's very difficult to see, but that site easement is the large area, the pink. And I discussed with the NCDOT, and we had that waived because it's being maintained, it exists, and if the county does anything, they're going to have the same site easement. So they were able to waive that, so we're not requesting that anymore. However, in order to do that 4-foot widening to get the left turn lane in and to add a right turn lane at that driveway, we needed a little bit of right-of-way, and we needed a drainage easement to keep the drainage ditch. This is relatively routine. I'm sure you've seen it about any development. This individual wants to develop his property, wants to do something good, and I have, out of 7, the county's the only one that I have left. I've gone out and met all the property owners, got letters of intent signed, and we're working on the actual exhibit plats and right-of-way agreements. Because the site distance easement is so large and it was waived, I was hoping that this commission would consider granting us the easement that we've shown, knowing that this particular facility is DOT maintained, and the new legislation, if they don't, I'm going to have to go to the DOT and have them exercise their right to stake maintenance limits and build the left turn lane anyway, but the right turn lane, I'll have to try to get it waived, because if you look at the property, you look at the ditch, this does not go beyond the back of the ditch line as it exists today. And I know Kyle's got some concerns and or things to say, so with that, I'm more than willing to answer any question. I see very little to no risk because of the years of experience that I have, and knowing the comprehensive transportation plan, when you develop, you're gonna have to preserve 40 foot from the center line, no matter what. And when we widen, we're gonna be within the existing ditch line, which you could never move that closer. And we were gonna put curb and gutter to minimize the impacts as most as possible, so we didn't have to encroach anymore. And that's sort of down low. I met Kyle and some staff out there. We looked at it. I guess there's some unknowns on the county side.
Go to the next attachment. Might help display it a
Yep.
little bit. Keep on going.
That one, there's the simplified version,
Yeah,
yeah.
if you
Blow
could-
that up.
Yeah, expand that a little bit, might help explain it.
And I indicated on there where most likely the county drive would be required by the city and the state, just because the terrain there and the drive that's across, that generally you would have to come in across. But like I said, the line of sight has been waived with the state. The right-of-way is a very little small portion to get the right turn lane in. And then in order to get in there and establish and allow the state to maintain the ditch, when we were done, we would need that permanent drainage easement.
So yes, staff's recommendation would be to not grant, because we've done no design on the site. And that would only be what I could say in good conscience. Now, I've met out there, I've walked it with Joe, I've looked at it, and quite frankly, I've been involved with a lot of these, both privately and with the county. Do I see a risk to anything we're gonna be doing out there by granting them? No, but we have not done one bit of designing out there. So I could not make that recommendation to the board in good conscience.
So we deny, they had to just work through DOT.
Yes, and the DOT has a mechanism to come
To-
get what they
to get
want,
what they
one way,
want.
one way or the other.
Excuse my French, but I just got to get a hell no before I approach the DOT.
Right, I understand.
I don't want to go to them
Well, if it may be
when I
out there.
haven't exhausted all my options.
All right, I think you're gonna get a no then.
Okay.
All right, let me, anybody,
For me, Kyle, you've been here through a lot of projects, and we know they change. And I know right now we don't see an issue, but we see change orders and things happen all the time. So if that's what your good conscience is saying, I fully support you, because you've not led us wrong the entire time I've been here. So,
Thank you. I don't recall any of those change orders on my project. but yes. Thank you, yes.
Well, and I don't, obviously, I haven't had the opportunity to work with you yet, Kyle, but I do appreciate you being open and honest about this, because these photos and things like that, just that I couldn't, it's hard to picture. And because we have no design for the animal shelter, I certainly don't want us to run into any kind of situation that is going to cause us to have to spend more money on the shelter as it is. So I thank you. I respect, and of course, I also respect you for coming to ask us, because I would much rather come here than probably have to go through the DOT process.
I've known your staff for years and years, and we work really well together. Some things just have to be done.
Yeah.
And I'm a big boy, I don't get my feelings hurt.
Well, thank you. Thank you for coming.
so I guess we need to put on an agenda for denial.
Do
On
you
the
need an
consent
answer
agenda?
tonight?
Do you need to answer tonight? We
I
can,
mean, no, I mean, I know what the answer is.
Yeah, you know what the answer is.
That's all I need.
Then it'll be on the
Trust y'all.
agenda.
we'll put it on the consent agenda as a
Okay,
denial.
that's perfect, yeah.
Perfect, okay.
Seems to
Thank you.
me you
Thank
seem
you.
to be a very secure person.
Well, I've been before a lot of boards, believe me. A lot more unpopular things than that.
Thank you very much.
Thank you.
All right, next we got the facility design and construction for the development of the suite renovation. Michael Miller. There he is.
Good evening. This item is in regard to the planned renovations of the construction standards and planning and development offices, which are located here in the governmental center on the opposite end of the building. Both of those spaces are basically original to the building, with the exception of some new carpet and paint and furniture over the last 30-plus years. So the renovations would meet the needs of a staff that's grown over the years, would provide small conference rooms for private meetings with the public, and would provide an opportunity for better customer service. It'll provide more space for the permit technicians and plan reviewers. It'll provide improvements in handicap accessibility. And the space will better meet the current needs, current operational needs, because most of the work now there is done electronically versus pencil and paper like it used to be done. So we've been working with Ken Griffin at Griffin Architecture here in town, and we've approved a conceptual design for the project, and we're now ready to enter into the contract for full design and construction. And we currently estimate the design, construction, equipment, and technology cost of $2 million. Funding to cover the entire cost of the project is available in the restricted fund balance that's generated from permit fees, which are collected by Mass Department. So actually, according to the general statute, those funds can only be spent in support of that department where they were collected. So the request tonight is for approval of the budget amendment and project ordinance that you have in your agenda, which will move funding into an account where it can be spent for the project. So do you have any questions regarding the project or the budget amendment?
And again, this is completely funded off revenues from our permit sales.
Anybody got anything? Everybody agree to put it in the consent agenda and approve it? Okay. Move it to consent.
Thank you.
All right, we have the human resource personal ordinance update.
Good evening, Commissioners. I'm Ashley Dobbins, the HR Director. I have Captain Chris Smith with me tonight in case you have any questions about the ordinance change. So I'm just going to share this, this personnel ordinance change that was in your packet regarding the law enforcement special separation allowance. I'm going to summarize what all that language meant. So before July 1st, 2025, there was one option for retiring law enforcement personnel. Under the criteria for the traditional option, if an officer had 30 years of service at age 55 but wanted to continue working, most wouldn't because the special separation allowance would stop at the cutoff age of 62. Because of this, the retiring officer would lose some of their benefit if they didn't go ahead and retire. Effective July 1st, 2025, Session Law 2025-8, House Bill 50, added an additional option for those who may want to work past 30 years of service. Under the criteria for the new 30-year fixed benefit option, an officer that had 30 years of service at age 55 but wanted to work another 2 years, for example, could without feeling penalized. This option would allow the officer to receive their special separation allowance from age 57 until age 64 in this example. This bill will allow all seasoned officers to stay longer if they so choose. It also provides an opportunity for them to train and mentor the new generation of law enforcement. There's no anticipated budgetary impact with this change. Do you guys have any questions? Okay. All right,
Everybody-
thank you.
Everybody agree to move that consent agenda approved? Yeah, all right, move to consent. All right. You here for the grant?
I am, sir.
Go ahead.
As she said, I'm Chris Smith with the Sheriff's Office. The first one is acceptance of a technology grant from Turnkey Corrections. Turnkey Corrections is one of our vendors in the detention center. Is offering a $5,000 technology grant that intends to be used to replace our aging booking camera to be compatible with a new records management system. The next item is the surplus of K9 Nora, 7-year-old laboratory retriever due to some, sounds like significant health issues. Nora's been one of our IED detection dogs. First assignment was the courthouse and still assigned to governmental security where she's done a great job and her handler has well. So this would be for her to be surplused and placed with her handler, Deputy Chris Hartzell, who's had her, I believe, to my knowledge, since we had her.
Yeah.
So those are tough.
I just want to say that Nora is a sweet, sweet girl, and we love her, so,
She'll still be around.
yeah, I hope so.
Yeah, she'll still be around.
All right, so we put both those items on the consent agenda?
Thank you.
Thank you. All right, next. Tax Administrator write-offs. Is David, David's here, okay.
Good evening, Commissioners. The tax collections team uses all available resources, due diligence, and all statutory remedies that are available to authorize us to collect taxes on real property and personal property tax bills. However, North Carolina General Statute 105-378A, titled Use of Remedies Barred, prevents the tax collector from exercising any new enforcement remedy to collect taxes on bills that are 10 years old from the date that they first became due. So tax year 2015 tax bills became due September 1st, 2015, and are now 10 years old. And because we cannot initiate enforced collections on those outstanding balances that haven't already been initiated, we ask this board to allow us to write those tax bills off, those balances. So our request tonight is a motion to approve the write-off of real and personal outstanding taxes for 2015 totaling $126,076.83. And I'm happy to answer any questions you have.
I don't have any questions. It is what it is. All right, everybody agree to put that on consent agenda? Yeah. All right. All right, next.
Thank you.
This is on the finance, for the county manager and the finance director to research on behalf of the commissions, some Board of Education funding and school funding. Is that correct? Do you want to discuss anything before?
This action would authorize Jim and I to approach the LGC and begin those conversations regarding the financing that we've been discussing for the 6 projects that were identified, that we can take action with under this plan without increasing the tax rate due to this debt.
And I see here it's got Northwest Cabarrus High School, Northwest Cabarrus Elementary School, renovations for Jackson Park Elementary School in Kannapolis, renovations for A.L. Brown High School, RCCC Workforce Center build, and then the renovations for S201.
Correct.
And we would not have to raise taxes to get these projects done.
If we are
correct?
able to follow the path of the grant financing, that will allow us to do that. The other thing about this is we still need to have further conversations. We're waiting on Kannapolis City Schools to see if they acquired a grant for A.O. Brown. And both projects in Kannapolis City Schools would require Rowan County to participate. And so we would need to work out something with them too, I think, about who reimburses whom and that kind of thing, because I think one person would have to hold the debt. So still some things to be worked out on that, but this will authorize us to start that process.
And to get those projects up and running, we got to start now, so we can find out where we are in the next couple months. And we can tackle that. I know the school board needs it badly. The community does too, so. All right, we have a motion authorized. We're going to suspend the rules. Motion to suspend the rules. All in favor, say aye. All right, that passed 4-0. Now we have a motion to authorize the interim county manager and finance director to undertake research on behalf of the Board of Commission concerning financing of those projects. All in favor, say aye. Aye. All right, passed 4-0. All right. Next is update on Holloway Group.
So I again spoke with Mr. Holloway, and obviously the bulk of things going on in Raleigh recently have been around redistricting. There has been some slow movement on the budget, but they think that it will be 2026 before a budget is adopted.
And what I'd like to do, instead of doing this every month, at least extend it out till March, our next March meeting, so we don't have to vote on it each month, that we're going every 3 months, and leave them intact, and then we'll see where we are in March.
I agree.
All right, guess we still make a motion. We're under suspended rules.
Yes,
I can make the motion to suspend the
Yeah.
rules.
I would
Okay.
say just bring it back, make a motion to bring it back in
Yeah,
March.
we never, okay, yeah, exactly. So motion to review again in March. Yeah.
I'll make the motion to review again in March.
Okay. Oh, for the record, we unanimously approved suspend the rules, and then we got to vote on bring it back in March. Everybody in favor, say aye.
Aye.
Opposed? All right, 3-1, it passed. All right. We don't have to suspend the rules. All right, so I have a motion to approval of the regular meeting agenda, but we added an item to it tonight, a couple items to it tonight, right? Yeah, I think we added Kenny's.
Yes, the SNAP program, and then an update for JCPC.
Right, okay, perfect. So with those amendments, do we approve the regular meeting agenda? We have a motion, okay, second. All in favor, say aye. Aye, that passes 4-0. Looks like I got nothing left to do but adjourn. All right, do we have a motion to adjourn? All in favor, say aye. Aye. All right, pass 4-0. We are adjourned. Thank you all so much.